You guys to really listen up. I need you guys to really subscribe to my channel, share this video, like, and make a comment down below. This is incredible. We're in the United States, and I need you guys to listen at this and listen up well. Now we are going to see who lives and see who dies with a scale that Harvard is going to make for the hospitals to put people on a scale of seeing who dies and who lives out of this coronavirus. The coronavirus is really something. Check this out.
Unimaginable reality that doctors across the country may face in a worst case scenario. Medical professionals tell CNN they hope it never comes to it, but they're forced to develop a point system in the inevitability that hospitals need to decide which patients get life-saving care and which don't. It's a nightmare scenario, of course. It's not inevitable, but it might happen. CNN's Drew Griffin is taking a closer look now at how this protocol might work and how close we are to needing it.
The horrifying pictures from inside New York hospitals show patients hooked up to the only machines keeping them alive. When the virus takes over the lungs, ventilators take over the breathing. Without them, immediately when needed, the prognosis is dim.
It's bad. You can watch a patient go from breathing room air to 72 hours later needing to be intubated.
So far, hospitals have kept pace, but barely. The situation's so bleak, the U.S. government put out a video on treating 2 patients with 1 ventilator.
You obviously wouldn't do it unless you were in dire circumstances.
But the dire circumstances are here. States and the federal government are in a bidding war for ventilators made in China.
We can't get any more ventilators.
And it is time now to prepare for what may be the inevitable. This article in the New England Journal of Medicine was written to prepare doctors in the event they must choose who gets a life-saving ventilator and who does not.
Unreal.
Robert Trube is one of the authors.
I worked all weekend on helping on a number of them, and hospitals now, many hospitals have these in place. So I think that it's going to be extremely difficult.
Unbelievably difficult for those physicians who have to make the call.
That's right. And of course, the families and patients as well. These are life and death decisions, and it's going to cause a tremendous amount of suffering if we get there.
The decision who lives,
you gotta
who
pay
dies,
for it.
would come down to a point system. The elderly, patients diagnosed with cancer, COPD, diabetes, any chronic lung or terminal illness, would be eligible for care but score lower than those who are otherwise healthy with a potential longer life to live.
Unreal.
The points would determine what's in the best interest of society, not just the individual.
Wow.
Everybody is eligible, but
you hearing
beyond
this?
that point, then it does come down to giving it to those people where we're either going to save the most number of lives or the most number of life years. And yes, it does mean that people with other severe illnesses will receive a lower priority score.
In New Orleans, where the virus is predicted to get even worse, there are enough ventilators now, but within days, they could be out.
And then after that, you begin having very challenging conversations about how you allocate the vents, and you think about which patient would benefit the most. And that's a horrifying place for anyone to be in, and it would certainly be a damning indictment of our country.
And Jake, what is infuriating about all of this is it was predicted. CNN has found 10 government reports between 2003 and 2015, all predicting that if we faced a pandemic just like this, we would run out of ventilators. And here we are.
And here we are.
Pulmonary critical care and sleep division. Dr. Powell, thanks so much for joining us. I understand you're using simple parts to help convert CPAP machines into ventilators. Explain to us what a CPAP machine is, how you came up with this, and